Right, and just to give you an idea of the scale here, Vivint says that around 8,000 people in Wisconsin are living with HIV. Vivint gets nearly $2 million from the federal government to treat them, and they say that losing that money means less people would get life-saving health care. Gregory Leone, owner and chef at Amalinda in Milwaukee, was diagnosed with HIV in 1999.
Can't help but start planning your own funeral.
He's one of about 8,000 in Wisconsin and one of about 4,000 in the Milwaukee metro.
But today I'm healthy. I'm called what's called undetectable.
Thanks to treatment he gets at Vivint Health, a multi-state nonprofit dedicated to testing and treating people with HIV.
Probably about 90% of the people we serve are living at or below 200% of the federal poverty limit. And what we also know is that the medications that are used to help keep people living with HIV alive and healthy are really expensive.
This week, multiple national news outlets reported the Trump administration is considering major cuts to the CDC's HIV prevention division, putting about $1.3 billion in jeopardy. 1.9 million of those dollars used right here in Wisconsin.
We make sure that income is not a barrier to care.
It's a steep cost.
My one pill a day, a month's supply is $4,700. And I have a successful business. I make a decent living. I can't afford my own medication.
What happens if that 1.9 million goes away?
The truth of the matter is, at some point, we're not going to be able to afford to deliver the same level of services.
And if those services disappear,
we'll live in the 80s again. It'll just be in the 2020s or 2030s. And we can avoid that.
So, Emily, no official action on this from the White House just yet.
Right, nothing official yet. A Health and Human Services official telling Reuters that prevention programs could be switched to another federal agency. Vivint says that the state likely won't be able to fill the funding gap, though, if the program does get pulled.